friends. Uh, Hi, this is Dr. J P Ravan from Kalinga Institute of Medical Science, Department of Psychiatry. Uh, I know that we are going through a very difficult time in the pandemic of COVID-19. The whole world is struggling. The whole human civilization is suffering. In this scenario, the case of anxiety and restlessness, hopelessness, worthlessness are very common. Here I am here to give you some of the tips to how we can reduce our stress and navigate through this difficult time and protect our family, protect our friends, near and dear ones, and remain safe and remain healthy. Psychological effects are seen in the public very much. So the first one is that we should remain connected with people whom we like, and we should share the emotional and other stress related issues with our near and dear ones, and that will help us to reduce internal feeling of restlessness and anxiety, and that will give some kind of mental peace. Secondly, if you see that we need to actively avoid certain news item in social media or in news channels which are very negative and induce or increases our anxiety. So we should also protect our children, protect our elder, and protect our working community, and also the women who are working in the home. So as far as children are concerned, in the age group of 0 to 2 or 3 years, in the early stage, if the mother is very protective, if mother gives a good nurturance, then they remain healthy and they remain safe. No matter what happens by the pandemic in the outside world, they remain unaffected. The joyful phase of the child in the first 2 to 3 years is being protected by the mother and mothering figure in the early childhood. The children who are 3 to 7 or 8 year old, they understand certain things and their mind is not that mature to process everything in a logical way. So they remain very susceptible to undergo severe irritation, irritable mood swings, aggressions, and other disinhibited behavior, and so on. So these children should be mostly kept busy through a routine work, and different kind of skill development program should be there for them, so that they will learn new things, they hear new stories, and because of that they remain busy, and they can be remain in contact with the grandparents in the house, and then their time also will be passed properly. Those who are adolescent and young adult, they are facing the most difficult time because of this pandemic. Their career, their education is all getting affected. Mostly they have to adapt to the situation, go through online training, learn new things and new skills through online programs, and wait for the time, remain hopeful that time will change and they will again become normal, and their career and everything will progress as smoothly as before. Those who are the adult like us, they need to work, but they have to maintain safety precautions, and they have to remain positive, and that will give them a balanced mental health. For the elderly people, they are the very important figure of our society, and we need to protect them, we need to talk to them, and they should also express what is going there in their mind, what is making them anxious. And if we remain united, if we remain connected, and if we remain emotionally sympathizing and empathizing to each other, then this time will pass off and we will all become again normal, and we will again enjoy the life as before. So I hope that mental illness, psychological pain, suffering should be less in this difficult time, and gradually people should come back to their normal function. With this, I will end my talk. I am signing out and hoping that you stay safe and stay healthy.